While osteoarthritis is common, it doesn't have to control your life. With the right physiotherapy approach, you can stay active, independent, and pain-free. Hi, I am Josephine Vishal, and if you or someone you love is living with arthritis, this video is for you. Osteoarthritis causes the cartilage in your joints to wear down over time, leading to pain and stiffness, swelling and reduced mobility, difficulty walking, bending, and climbing stairs. But here's the good news. Physiotherapy helps by strengthening the muscles around the joints, improving joint alignment and mobility, reducing inflammation naturally. Try this easy move. Sit in a sturdy chair, extend one leg out straight, hold for 5 seconds. Slowly lower. Do 10 repetitions on each leg twice a day. You don't need to rest forever. In fact, staying active with guidance can delay the need for surgery and improve quality of life.
Let's move on to the Q&A segment. Will exercising make my arthritis worse?
Not at all. When done correctly, exercise protects your joints by keeping surrounding muscles strong. We'll customize it for your level.
Can physiotherapy prevent surgery?
In many cases, yes. With early intervention, joint replacement surgery can often be delayed and avoided through strength and mobility work.
Is this just for seniors?
No. Osteoarthritis can affect younger adults too, especially after injuries. Everyone benefits from movement-focused care. If you're living with osteoarthritis, know that you're not alone and you're not powerless. Book your physiotherapy session today and let's help you stay strong and mobile for life.